Welcome back to the deep dive. Today we're diving into something that I know a lot of you have been curious about, ocular hypertension. It's a condition that affects millions, and it can sound kind of scary, but we're here to break it down, make it easy to understand so you can feel confident talking about it.
Yeah, and what makes ocular hypertension so interesting is that it's often called, the silent thief of sight.
Mhm.
Early detection is really key, just like with high blood pressure. A lot of people might not even know they have it until it's progressed.
Right, and that's why we're talking about it.
Huh.
Our listeners sent in some fascinating stuff, and one thing that jumped out was this whole pressure buildup thing inside the eye. I gotta say, that sounds a bit unnerving. Can you walk us through what's actually going on in there?
You're right, it can sound a little alarming if you don't know what it is. So picture the front part of your eye. You've got this fluid called aqueous humor, and it's always circulating, providing nutrients, keeping the eye's shape. It's all about maintaining this delicate balance, right, between production and drainage.
So fresh fluid comes in, and then it needs a way to get out, like a flow-through system.
Exactly. Now imagine the drainage channels, we call it the trabecular meshwork. Imagine they get a bit clogged or they're not working as efficiently as they should. Fluid can't escape as easily. And that leads to, you guessed it, pressure building up inside the eye. That's basically ocular hypertension in a nutshell.
Too much in, not enough out, and the pressure starts to rise. What gets me is you might not even realize it's happening. The material we have mentions that it can be a silent progression.
That's exactly right. And it's a big reason why regular eye exams are so important, especially if you have any risk factors. People over 40, family history of glaucoma, individuals of African descent statistically are more susceptible and need to be extra vigilant.
Okay, so it's not just an age thing then. There are certain groups that need to be even more aware. Now, the material our listeners sent also mentions glaucoma. Are those the same thing, or is there a connection?
Great question. It's super important to understand the difference. Think of ocular hypertension, like the warning light on your car's dashboard, right? Glaucoma would be like the actual engine failure. So ocular hypertension is the risk factor. It's that elevated pressure. Glaucoma is the actual damage to the optic nerve, which is what sends visual information from your eye to your brain. And that damage can lead to vision loss.
So ocular hypertension is that early warning signal, and catching it early is key before it potentially turns into something much more serious. What causes this pressure buildup to happen in the first place? Our listener gave us a lot to work with here.
It's not always one thing, to be honest. It can be a few things working together. Genetics definitely can play a role, but our listener highlighted some other crucial factors, like certain medications, for example.
Wait, like medications I might be taking every day could actually be upping my risk.
Exactly. It's something a lot of people don't realize. Corticosteroids, they're powerful anti-inflammatories, but they can sometimes cause a rise in eye pressure, especially with long-term use. And even certain antidepressants have been linked to this too.
Wow, yeah, those are meds that a lot of people take, so that's definitely something to be mindful of. It really shows how connected everything in our bodies is.
It really does, and why it's so important to look at the whole picture, right?
Yeah.
So we've got medications as a potential factor, but our listener also pointed out eye trauma, past injuries, things like that.
That makes sense, right? If those delicate drainage channels get damaged, it's like kinking a hose, the fluid can't flow properly.
Exactly. Any damage to that system can throw things out of whack. And of course, there's the connection between our heart health and our eye health too.
Yeah, the material mentions high blood pressure. So if your blood pressure is high in general, that increases your risk of ocular hypertension as well.
It does. It's all interconnected. You know what else I thought was really interesting? The listener brought up something I hadn't really considered before, sleeping position.
Sleeping position. You're kidding. Like how I sleep could affect my eye pressure.
It sounds strange, right? But there's research that suggests if you sleep with your head elevated, something like a 20-degree angle, it might actually help improve fluid drainage from the eye.
So ditching that pancake flat pillow could actually be good for me. This is blowing my mind. Okay, so we've talked about what causes this pressure buildup, but what can you actually do about it? Our listener mentioned home remedies. What's the deal with those?
Before we jump into those, I do want to be really clear. Lifestyle changes can definitely help, but they should never, ever replace medical advice or treatment. If you think you might have ocular hypertension or you're having any vision problems at all, see an eye doctor.
For sure, for sure. This isn't about self-diagnosing or trying to treat yourself, right? This is about getting informed so you can have those conversations with your doctor.
Absolutely. Okay, now about those lifestyle changes. A lot of them, thankfully, are just good for overall health, too. So it's a win-win, right? For example, maintaining a healthy diet is super important.
Eating for good eye health, so I'm getting a two-for-one deal here.
Exactly. The material our listener sent in talks about how important antioxidants are, for protecting your cells from damage. Vitamins A, C, and E, those are the big ones, and they're found in lots of colorful fruits and vegetables.
Those are the ones we're always told to eat. Eat the rainbow, they say. Good for your eyes, too, apparently. What else is on the lifestyle checklist?
Hydration is another one, but there's a bit of a catch here. Staying hydrated is essential, of course, but the listener pointed out that drinking a ton of fluid all at once can actually cause a temporary spike in eye pressure.
Interesting. So, sipping throughout the day is better than chugging a whole bottle of water at once. Makes sense.
Exactly. And then there's stress management, things like meditation, deep breathing. Even yoga, those can be really helpful because chronic stress can actually contribute to higher eye pressure for some people.
Yeah. It really all comes back to that mind-body connection, doesn't it? And of course, we can't forget about exercise.
Absolutely not.
Yeah.
Regular physical activity is essential for so many reasons, and that includes eye health. It can improve your blood flow, your circulation, and that's important for maintaining healthy eye pressure.
So, all that stuff we know we should be doing anyway, good for our eyes as well. What about when it comes to treating ocular hypertension, medically speaking? Are there things doctors can do to address it directly? So lifestyle changes are great, but what about when you need something, a little more heavy duty? What can doctors actually do to treat ocular hypertension?
Well, the good news is we've got some really effective treatment options, and the best part, your doctor will work with you to create a personalized plan based on your risk factors, your health history, how severe the condition is, all of that.
It's not like a one-size-fits-all thing then. They really tailor the treatment.
Exactly. They look at the whole picture. Now, often the first line of defense is prescription eye drops.
Eye drops. So not just the regular kind you can get over the counter.
Right. We're talking about special eye drops that are designed specifically to lower the pressure inside the eye to bring that intraocular pressure down.
Makes sense. So what kind of eye drops were we talking about? I know the material mentioned a few different types.
Yeah, there are a few different classes, and they all work in slightly different ways. The most common ones you might have heard of are prostaglandin analogs, beta blockers, and carbonic anhydrase inhibitors.
Those are some serious-sounding names.
They can be a mouthful. Basically, these medications either reduce how much of that fluid, the aqueous humor, is being produced, or they help it drain out more easily. And that's the goal, right? To lower that pressure.
So they're fine-tuning that whole fluid balance we talked about.
You got it. Now, sometimes eye drops alone aren't enough. If that's the case, there are other options, like laser procedures.
Laser procedures on your eye. That sounds kind of intense.
It sounds scarier than it is. The material we have here mentions two types in particular: argon laser trabeculoplasty, or ALT, and selective laser trabeculoplasty, or SLT.
I am not even going to try to repeat those.
Yeah, they're a mouthful. Basically, they use lasers to make it easier for fluid to drain from the eye.
So kind of like giving that drainage system, the trabecular meshwork, a tune-up.
Exactly. And what's interesting is that SLT is often preferred because it's less invasive and has fewer side effects than ALT. It's a good example of how technology is always improving things.
Wow, that's amazing. So we've got lifestyle changes, different medications, laser procedures. Seems like there's a lot you can do to manage ocular hypertension. But the million-dollar question, I guess, is, can you cure it?
That's the thing, and our listener was very clear about this in their research. Right now, there's no cure for ocular hypertension. But, and this is a big, but it is highly manageable if you catch it early and get the right treatment.
So even though you can't make it go away completely, you can definitely keep it under control and prevent it from getting worse.
Exactly. And that's why those regular eye exams are so important. By being proactive, by knowing your risk, you're giving yourself the best chance of protecting your vision.
That's a really powerful message and actually kind of reassuring. It's not about being scared. It's about being informed and taking action. We've covered so much today about ocular hypertension. It's amazing how much there is to learn about this. But there's one question I have that I don't think our material addressed. With all the amazing advancements we have in medicine, why haven't we figured out how to cure this yet?
That is a great question, and it's one that researchers are working on right now. There's still so much we don't know about the eye and what causes ocular hypertension.
It's a good reminder that even in this day and age, there are still mysteries to solve. Who knows? Maybe someone listening right now will be inspired to pursue a career in ophthalmology and be the one to discover that cure.
Wouldn't that be something?
It sure would. Well, on that note of endless possibility and the power of curiosity, we're going to wrap up this deep dive into ocular hypertension. A huge thank you to our amazing listener for setting this topic our way. And remember, everyone, knowledge is power and early detection is key. So schedule those eye exams and keep those eyes healthy. Until next time.